we will go ahead and get started. First, I want to welcome you to our Silence Equals Violence conference. This is not like our previous meetings, and so I appreciate you being here. We have a great agenda for you today. And in fact, today of all days is a day that you do not want to miss. And so once again, I just want to appreciate you for being here and taking the time to meet with us today. We have over 100 registrations for today's conference, so we'll probably see our number of attendees grow throughout the meeting, and we look forward to working with you in the future. Before we get started, or before we get to our programming, I want to let you know that today was brought to you through collaboration. Our Silence Equals Violence network, which has been in existence for over 8 years now, is rooted in equality for all, where violence against people with disabilities and older persons is no longer inevitable, and where all people can fully exercise their rights. We look forward to continuing to work with all of you. We can't do it without each other. So we definitely would not be here today had it not been for the dedication from you, our network, but also from our Silence Equals Violence Planning Committee. Briefly, Mark Starford from the Board Resource Center is on the planning committee, as well as Keisha Weller, an abuse prevention advocate, Teresa Anderson from CPC-IDD, myself, Eden Rosales from the State Ombudsman's Office, and our ace in the hole, the person responsible for making us all look good, and the true force behind today is Tyler Hershey. He's a project coordinator with the ARC of California. So thank you, round of applause to the planning committee. A special thank you to you, Tyler. I do see a hand up. Teresa, did you have something to add? Or?
No, I was just trying to do a clapping hands for Tyler.
Got it.
Failed.
Okay. Well, I know they're out there clapping for you folks. Okay, well, with that, let's do a brief review of the agenda and then we can go ahead and get started. Today, we're going to hear from Ranjana Maharaj from CDA, California Department of Aging. We're going to hear from Jung Pham, Disability Rights of California, Astrid Zuniga from United Domestic Workers of America. We have Maureen Sullivan from Weave Incorporated. If you're interested in learning more, their bios are linked in the agenda under blue text. We will also have a moment to hear from Greg DeGier, and he'll be updating us on legislation for the anti-hate crimes. And at the very end, if there's time, after all of our presentations and discussions, we'll talk about our 2025 priorities. So looking forward to that. Little housekeeping is the chat feature has been enabled. So if you have questions throughout presentations, drop them in the chat and we'll make sure the presenter is aware of them and we'll answer them as time allows. So with that, let's go ahead and get started. And per agenda, let me turn it over to you, Ranjana.
Thanks, Eden. Good afternoon, everyone. Again, my name is Ranjana Maharaj, and I serve as the Elder Justice Specialist at the California Department of Aging. I would like to thank the Silence Equals Violence team for having me here today. And I'll be discussing how California is advancing elder and disability justice through the Master Plan for Aging, with recommendations from the Elder and Disability Justice Coordinating Council and their collaborative strategies to build a safer, more equitable future for older adults and adults with disabilities. Next slide, please. I'm sorry, Tyler, I'm not able to see the slide.
How about now?
There we go. Perfect, perfect. Next slide, please. And next slide. Thank you. Just to provide a little bit of background, the Master Plan for Aging was developed between 2019 and 2020 with significant input from stakeholders and the public. In 2021, Governor Newsom signed the executive order releasing the Master Plan for Aging 10-year blueprint to prepare for California's growing aging population. The MPA is focused on creating communities where everyone can age and thrive equitably while promoting coordinated services and streamlining navigation tools using a whole of government, a whole of community approach. And in 2021, one of the initiatives was Initiative 93, which specifically called for the creation of the Elder Justice Coordinating Council, which kind of mirrors off of the federal Elder Justice Coordinating Council. And with stakeholder feedback, it was then changed to the Elder and Disability Justice Coordinating Council. And elder justice is a core priority of the Master Plan for Aging, ensuring that we're safeguarding the rights and well-being of older adults and adults with disabilities. Next slide, please. So for the Master Plan for Aging, we have 6 key stakeholder advisory committees which advise the Master Plan for Aging. The stakeholder committees bring over 250 voices representing state and local agencies, advocacy groups, and community organizations. And these committees ensure that the MPA is reflecting diversity and meets the community's needs. The committees also provide their recommendations to influence the aging and disability services programs statewide, and it shapes systemic change for older adults and adults with disabilities. It also has a cross-sector approach. The committees elevate community voices, and they foster the partnerships to advance equity and inclusion. So it's really amazing that we have these advisory groups, and many are stakeholder-led. Next slide, please. I also wanted to share some of the members. The Coordinating Council reflects, like I said, reflects a broad range of state agencies and organizations. They all have expertise related to elder justice initiatives. Each state, county, and federal department has a role in elder justice, and some of the state agencies have designated their own representatives to attend the Coordinating Council to listen in and take back the recommendations provided by stakeholders. I listed a few off the top of my head. I know we have my organization, which is California Department of Aging. We have Department of Justice, Department of Social Services, Office of Emergency Services, and then we have the federal partner, ACL, the Administration for Community Living. And then from a county level, we also have the County Welfare Directors Association taking part in the council. Next slide, please. Excuse me. So the Elder and Disability Justice Coordinating Council purpose is to increase coordination and develop recommendations that address abuse, neglect, exploitation, and fraud. Excuse me. The council emphasizes the importance of collaboration among government agencies, community organizations, and healthcare providers, and the stakeholders on elder justice initiatives. And they foster the partnerships, and they create comprehensive networks that can then effectively address the diverse needs and challenges faced by older adults and adults with disabilities. So it's pretty comprehensive. It's very collaborative. Again, a whole of community approach, a whole of government approach. Next slide, please. Thank you, Tyler. So the California for All Ages and Disabilities Day of Action event is an event that brings together policymakers, aging and disability leaders, consumers, to address the needs of older adults, people with disabilities, and caregivers. I'm sure many of you have attended the 2022 or 2024, the recent Day of Action. But if you haven't, during the 2022 Day of Action, stakeholders presented on 3 key priorities for the 2 years after the Elder and Disability Justice Coordinating Council was established. Priority 1 was to focus on APS, Adult Protective Services, to improve delivery and coordination of services, training opportunities, and incentives to work in the APS field. Priority 2 was focused on the public guardian and public conservator programs to create a state unit responsible for oversight, allocation of funds, and data collection, because we don't have a lot of data for conservatorship. So that is a huge point that stakeholders are bringing in that we collect. Priority 3 was to focus on legal services to create the understanding and availability of programs, and also adopting restorative justice models where appropriate to to improve data collection. So those were the 3 key recommendations for 2022. Next slide, please. After the creation or after the priorities were provided, the focus of the EDJCC, the Elder and Disability Justice Coordinating Council, was to create subcommittees to focus on those priorities. So the Conservatorship Subcommittee, Legal Services Subcommittee, and Adult Protective Services Subcommittee were created. Each subcommittee is guided by dedicated leadership to make sure that there's alignment with the MPA and the goals. Excuse me. The Conservatorship Subcommittee is led by my colleague, Regina Wright, who is the Public Guardian Liaison, while I lead both the Legal Services and APS subcommittees. And together we collaborate closely with the stakeholder co-chairs who bring a wealth of expertise and community perspectives to inform and strengthen those efforts. We also have the stakeholder co-chairs who play an essential role in shaping the subcommittee's agendas, providing insight from their professional and both lived experiences and ensuring that our work remains grounded in the issues and concerns that are faced by older adults and adults with disabilities and their caregivers across California. So these subcommittees are the backbone of EDJCC, and they really tackle the complex issues for conservatorship, legal services, and APS. Next slide, please. So what are some of the focuses? What are some of the things that the subcommittee is focusing on? So the Elder and Disability Justice Coordinating Council subcommittees work collaboratively, and they bring together a diverse range of stakeholders, including advocates, local law enforcement, healthcare professionals, service providers, and leveraging their collective resource and expertise. The subcommittees also create unique approaches to advance elder justice. So not only do we have advocates, we also have caregivers that also speak on the person-centered approach, like what they're experiencing on the ground level. Each subcommittee also is tasked with identifying systemic gaps and inconsistencies that hinder effective elder abuse prevention and response. And their work is focused on developing actionable solutions that address those barriers and create meaningful change across the system. Developing strategies. So the subcommittees are also making recommendations and create strategies that align with the goals of the Master Plan for Aging. And by doing so, they promote a coordinated, multi-pronged disciplinary approach that strengthens the statewide framework for elder abuse prevention and intervention. Next slide, please. Thank you. So what have we been working on so far? 2023, 2024, I provided the overview for 2022. Currently, the initiatives listed on the screen, Initiative 66, 67, 68, and 69 were some of the initiatives that were being worked on by our subcommittee members. Initiative 66 strengthens the legal framework, ensuring that legal service providers are equipped to address critical issues like housing stability, financial exploitation, and elder abuse. Initiative 67 is a collaboration between APS and financial institutions, which it's really crucial to identify and address financial exploitation and the growing threat, the economic threat of security for older adults and adults with disabilities, especially with scams, which is pretty prevalent right now, given the AI tools that are being released. For Initiative 68, enhancing APS social workers, where they can provide more accurate assessments that lead to better outcomes for individuals who face abuse or neglect. And then Initiative 69, efforts that reflect the growing emphasis on empowering individuals with disabilities and older adults to pursue a supported decision-making, the ability to make decisions as a least restrictive alternative to conservatorship. So together, these initiatives work to educate older adults and adults with disabilities about their rights, their choices, and available resources, and it empowers them to make informed decisions to better protect themselves from abuse and exploitation. And then each initiative also underscores the importance of equity by addressing systemic barriers that ensures that services are inclusive and accessible to all Californians. Next slide, please. Thank you. So what are some of the accomplishments for 2024? Well, as I mentioned previously, we had a day of action for 2024 on October 8th recently. And again, this event brought together policymakers, aging and disability leaders, and consumers to address the needs for older adults, adults with disabilities, and their caregivers. And one of the focus for the subcommittees was to make the recommendations for the next iteration of the Master Plan for Aging. So the Master Plan for Aging is not static, it's pretty dynamic, and the initiatives change every 2 years. So for this year, the recommendations were presented at the Day of Action. I'll just summarize that for you. For conservatorship, it was to create an office of the public guardian managed at the county level by the California Department of Social Services. The second recommendation was from the APS subcommittee, was to establish a California Reporting One System and Services, also known as CROSS, for a centralized abuse reporting system. And lastly, from the Legal Services Subcommittee, their recommendation was to enhance and expand access to remedies for victims of abuse and exploitation. So not only were they working on the initiatives, they were also working to build together recommendations for the next iteration for the Master Plan for Aging. And these recommendations are still being reviewed by some of the state organizations, and then they'll go to the governor's office for review and approval and released early 2025. So please be on the lookout for, if you're interested in the next set of Master Plan for Aging initiatives, hopefully in January they'll be released. Next slide, please. Thank you. So our continued partnership in 2025, we are committed to advance elder and disability justice priorities through active listening, stakeholder engagement, and collaborative partnerships. And California Department of Aging will continue to elevate elder justice discussions, ensuring that we have person-centered, equitable approaches to create a safer, more inclusive state for older adults and adults with disabilities. Next slide, please. Thank you. What can the Silence Equals Violence team do to support the Master Plan for Aging and the Elder and Disability Justice Coordinating Council? I provided a few topics or a few highlights to support. Engagement and ongoing conversations is really important. By attending the Master Plan for Aging Stakeholder Committee meetings, your participation is crucial, and it ensures that inclusion from various different diverse perspectives helps strengthen strategies aimed in addressing elder and disability justice issues. So it's really important to engage. Sharing information on committee meetings, extending the reach of the discussions by forwarding information about the MPA stakeholder committee meetings to individuals, organizations, or networks that may be interested. This helps raise awareness and encourages broader community participation. And lastly, providing feedback or ideas for collaboration. So thank you, Eden, for suggesting that we discuss like what the EDJCC does, because if people didn't know, they wouldn't be able to attend. So as we move forward, Silence Equals Violence's input is invaluable, and sharing any feedback or insights or ideas for collaboration could enhance the efforts and further like implementation of the MPA. So by contributing in those ways, Silence Equals Violence can really help drive meaningful change and support to the mission. And by working together, we can strengthen California systems to support older adults and adults with disabilities, ensuring that their rights are protected. Next slide, please. So how can you register for the meetings? And I forgot to put the link, so I do apologize. I will throw it in the chat. So if you go to the, oh, I can't send it. Tyler, will you be able to send it out?
Yes, I will.
Okay, I'm gonna throw it.
Just
There
send
you
it
go.
to me and then.
There you go. If you go to www.chhs.ca.gov on the homepage, you're able to click the committees. And then once you click the committees, the committee page will come up and you could register for one of the 6 advisory committees that way. And all of them are open to the public. The materials are posted online if you're not able to attend. And then some of them also have the recordings where if you miss a recording, you can go back and check the recording out and the conversations on agenda items for that particular meeting. And with that, this is my last slide. I apologize for going quickly. I know we had a full agenda today, but again, I'd like to take this opportunity to be here today to present on what the EDJCC does and what the Master Plan for Aging is continuing to do. If you have any questions, feel free to reach out to me at engage@aging.ca.gov. And I look forward to working together to make sure that older adults and adults with disabilities are safe in California and are empowered and supported. And if you have any feedback or want to collaborate in advancing this mission, please don't hesitate to reach out to me.
Thank you very much. Let's see, do we have any questions? It looks like we have the Q&A feature as well as a chat feature. So at this point, I think entering a question in either of those places would be fine with us. Give that a few minutes or a few seconds, I should say.
Eden, I have a quick question.
Sure.
That was a great presentation. Thank you so much. I am really curious. You mentioned data on conservatorship. What is currently the process? Is there a work in progress for collecting that data? What does that look like?
There is. The public guardian liaison is a new role for my colleague Regina Wright, and she has reached out to a lot of the public guardians actually this year at the county level to take a survey, and she is collecting data. So once that data is received, like compiled and put together, it will be placed on our data dashboard that you can find on the Master Plan for Aging website. I could also put that in the chat or send it to Tyler to put it in the chat. But data is critical. We don't have a lot of data on the public guardian or conservatorship, and that's something that we're looking forward to having in the future. So that's a great question.
Great. Thank you so much. I appreciate it.
Thank you. There's another question in the chat, Eden. How do we become a part of these committees? So you can, if you want to be a part of the committee, you can definitely reach out to the stakeholder, the chairs. Their information is also listed on the EDJCC website. Or when we have open, we do have an application period open every 2 years, and I believe the next period is 2026. And the application will be open and posted. And at that time, if you are interested, you can submit an application to be a part of the committee.
Thank you. Okay, well, I appreciate your time today, Ranjana, and I hope that you can stay with us for the remaining panelists and other information to be provided on our agenda. So with that, continue to keep those questions coming in. We can get those to her. If there's time at the end, we'll go back and answer some. I know with myself, sometimes it takes a little time for me to think and formulate my question behind the thought that's burning. So, Ranjana, we really appreciate you being here today. It sounds like you have a lot of great work ahead of you, and we look forward to being a part of it. Hopefully, some of our attendees today will follow that link to your committee information and be prepared to submit their application officially in 2026, but until then, be able to contribute their feedback or input through your stakeholder meetings. So let me turn now back to Jung Pham, who is the Associate Executive Director for Investigations and Self-Advocacy with the Disability Rights of California. Welcome, Jung. We really appreciate your time as well. So I will turn it over to you.
Thank you. Thanks, Eden. And unlike Ranjana, I don't have a beautiful set of presentations because the way that I work is really more interactive as far as taking questions from panelists or the audience members. But I will go through some of the bullets that I felt were important that 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 organizing staff set out. Just a little bit of background on me. I work for Disability Rights California, and I support a variety of different programs. The two programs that I support that are particularly relevant to silence equal violence is our abuse and neglect investigations unit, and then the second program is our representative pay auditing unit. It was the investigative unit that got me involved, 7, 8 years ago with Silence Equals Violence. And through those years, our team of investigators and attorney have worked closely with many of you, either directly as individual advocates or through your respective agencies. So it's a small world, it's a small family, and I appreciate all the work that many of you have contributed to our cases. The other program, which is and I should back it up a little bit and I say that the abuse and neglect unit that I support, our primary focus is conducting investigations through this wonderful access authority that we have as part of the protection and advocacy system, and looking into crimes against people with disabilities, abuse against people with disabilities, looking at why those types of abuses are often treated as an administrative issue, or where there's not enough criminal justice systems involved. And we try to use the investigations to push for a lot of policy reform and do a lot of systemic advocacy. And it often takes us years to get an outcome. But when we do, we feel that it's something that impacts all of our work downstream. So that's the abuse unit. The one that I hope to be talking more about today is our representative auditing program, representative payee auditing program. And that was created through federal statute back in 2018 to basically, as a recognition by the federal government that Social Security is under-resourced and may not lack the necessary expertise to work with, to investigate and audit representative payees managing funds on behalf of Social Security beneficiaries. And they brought not just Disability Rights California, but the entire protection and advocacy network into the statute to basically take over from the Social Security Administration to perform these audits and investigations on representative payees throughout the state of California. Of course, Disability Rights California, we cover California, but we have our sister agencies in the other states doing the same thing. And just very briefly, so our focus, and I should qualify today's presentation to say that I don't approach financial abuse through the lens of the criminal justice system. So I don't want to speak as an expert on all the factors and all the things that they have to look at. So district attorneys, law enforcement, the Department of the Department of Medical Abuse and medical fraud and elder abuse, they all have a different lens and they all look at financial abuse differently, and all the other federal agencies that may be involved as well, and they have different thresholds for when they want to take cases and things like that. Now, we certainly get those cases to them because we recognize that we're very narrow in the way that we look at things, but our audits basically are on represented payees. So for those who may not know, if you are a Social Security beneficiary and for whatever reason, Social Security deem you without the ability to manage your own funds. So maybe they have evidence that the beneficiary may struggle to pay bills and pay rent and medication or whatever it is. They may assign you a representative payee. Now, typically, the kind of the preference is, of course, a family member, somebody who can help manage those monies for the beneficiary. But you know, many times it can also go to other nonprofits as well as corporations. And we've even encountered some very, very strange kind of arrangements, but and I can go into that later. So they manage the funds for the beneficiaries. As you can imagine, there are ample opportunities where, for whatever reasons, there is a gap in the oversight of how that money is being managed. Many beneficiaries, unfortunately, are not allowed as much participation and involvement in the way that their Social Security benefits are managed. And it's very easy, and we certainly have many, many cases that we take on that are unfortunately like that, where unscrupulous rep payees take advantage of that gap in that disparity in knowledge and power. And of course, that leads to the financial abuses that we see. And it's across all disabilities. Our audits cover all disabilities and many, many different entities from, parents, family members being rep pays all the way to big, nursing homes and corporations acting as fee for service rep pays. So basically that's their business of managing rep pays. Kind of touching on some of the bullets for our agenda, the way that we look and define the financial abuse and exploitation is not black and white, and it runs the entire spectrum. And a lot of this stuff, what sometimes I see amounted to abuse is really just gross mismanagement of beneficiary funds, and it's really difficult to sometimes identify and call out because it's oftentimes hidden fairly well under good intentions or complex accounting systems and processes that make it look like it needs to be done a certain way. And I'll give you an example later on the case study portions, the way that some nursing homes have found a way to do it. And we did this work also during the COVID pandemic and the lockdowns when there was not ready access to vulnerable residents in licensed facilities. And we saw that all kinds of shenanigans were happening because it was kind of like when the cat's out of the house, the mouse gets to play, right? And the Department of Public Health, unfortunately, were limited for very good reason, for safety reasons, in the activities they could do in these facilities. And then we saw, once the pandemic condition lifting, and we were going into not just nursing homes, but any long-term care facilities, including adult residential, serving regional center clients and folks like that with intellectual and developmental disabilities as well as mental health disabilities. We saw that, wow, that 2 years of complete absence of oversight has created a nightmare scenario of money management. So it's difficult to define, and at least for at least in the little world that we're in on that involves Representative Hayes. But I think we've been around for 6 years now, and so we've been really good at helping, not only helping ourselves identify it, but also helping the communities that call us about, hey, this is what's happening to my benefits or to the benefits of one of my clients. Do you think it's worth looking into? And we can usually tease out if there's some financial abuses or gross mismanagement involved. As far as what's happening now in California with people with disabilities and older persons to increase awareness and prevention of this, not a whole lot. There's been a lot of bulletins out there from the DMFEA, the Office of Inspector General, the Federal Office of Inspector General, various advocacy groups, including Disability Rights California. But I don't know if that has as much of an effect as a more grassroots grounded community effort. And all of the entities that have been out have been really well-meaning and done as much as they can. But I think there needs to be more of a revision of, is this actually effective? Ought we be working together, whether you are a state agency, a federal agency, a community organizer, a disability rights organization? Ought we be working together to coordinate a more unified approach to alert people of various potential places where financial abuse can take place? This we particularly saw this during the pandemic with the stimulus payments and just the sheer number of communications that were coming to beneficiaries about what they should be doing and how they should invest their, the payments that were coming in. And nowadays, we're actually in the new year in 2025, we're actually planning to explore launching a campaign addressing AI utilized scams against vulnerable adults. So not just Social Security beneficiaries, but just the use of technology to really sound like this is from a legitimate source, and it's really problematic for us, because we serve a population that they don't have a lot to lose, and what they lose is oftentimes really difficult to recover from. So that's something that we're trying to do now. But the awareness and prevention piece, to me, I would urge us all in this room to think about how we can coordinate better, and utilize our resources. And I even would love to see a subcommittee, a sub-work team of silence equal violence that focus on coordinating, synchronizing our efforts in raising awareness to the community, including to ourselves, because some of these scams, I probably would fall for them. They are incredibly sophisticated. So that's my word of encouragement for today. As far as thinking about a case study, and one that I've been thinking about because we have so many of them, a particular insidious one that I've come across several times, and not me, but my investigators and what we case conference and we report on, are the nursing homes' use of the overpayment system to charge the spend down requirements to charge nursing home residents, especially during the pandemic, where they were accumulating a lot of money, and a lot of, I would say, most people, most retirees, and certainly nursing homes, whether they turned a blind eye to it or not, I can't tell. But those funds were exempt from the as countable income, and what we would see is that they would, and I am not an expert in overpayment and Social Security. I have investigators that are incredibly good at that, and there could probably be a whole nother training about that, and we'll be more than happy to provide that. But what we saw was it was a very simple scheme, but it was very effective, which was that nursing homes would, so instead of using the accumulated funds that the resident have, as you imagine, the residents are typically folks that are in those facilities 24/7, so they don't get to go out a lot, certainly not on a shopping spree. And they would rely on, and you should be relying on family members to help spend down that money to buy them better things, warmer bed sheets, clothing, better meals than the ones that's provided for. So small things that the family really can make a big impact in. But they were what we saw in the notes. They were never involved by the facilities, and instead they would intentionally accumulate, let this balance accumulate. And then to a certain point, they would then send a notice to the family members. And oftentimes I would see these notices also go to a resident who would not have the capacity to understand really technical jargon, and then so what they would do is basically say, we need to spend you down, you're over this threshold, and we're going to put it all into your share of costs. So for this month we're going to treat you as a private pay uh, uh, resident. And so they would just basically pull from 1 minute to another, pull that entire balance and dump it into their share of cost. And we saw that time and time again, in facilities. And we called them out for it. We made attempts to get them reimbursed for that. Sometimes it was successful, sometimes it wasn't. Um, and of course, we would involve Social Security, because it would have been an illegal way of spending their funds. And then we will also try to get the IRS involved as well, because of some of these funds may be stimulus money that basically were misappropriated for share of cost. So that's a particular nasty example that I have. But a lot of the work that we do is not just finding a smoking gun like we did in these nursing home cases. A lot of it is about finding pattern of just mismanagement, reckless ways of doing things. And sometimes we work with the long-term care ombuds people or APS or community care licensing or DPH or whoever we try to contact. And we always try to offer the very specific knowledge we have about this space, so that when they go out and they do their visits and their own investigations, they come out with maybe another set of tools. And so to us, again, it kind of goes back to my desire before about having a subgroup that can share all that knowledge and coordinate our knowledge around financial abuse. Um, but a lot of the stuff we have is mismanagement, and that is really just hidden away either by the complexity of the accounting that's involved, which like parsing out what's what becomes really complicated, um, or it is just because of the lack of awareness of the needs of the beneficiary that is served by that rep payee. So it oftentimes it's not an easy smoking gun type case. We often have to really read between the lines and do a lot of interviews with beneficiaries served, have a really good understanding of their needs, do more interviews with the rep payees. Usually these are organizations and facilities, understand their accounting practices. So it's a layered approach. But those are the vast majority of our cases, like the ones that really, like at first glance, may not seem like a financial abuse, but to me, boils down to the same effect when you conduct your accounting in a grossly reckless way. Um, so I think I'll halt it there. And I should say I should back it up a little bit. So the reason in 2018 that federal government created our program or funded our program through Social Security was because of reports out of some of you may have heard of Henry's Turkey Farm. It is a turkey slaughtering farm in Adalisa, Ohio, I believe. And they were housing individuals living with developmental and intellectual disabilities. And basically they had organized it in a way so they were getting, it was in essence, it was slavery. They were shacking these individuals into very poor homes, poor living conditions, and they were collecting all of their social, they were the rep payee, and they were collecting all of their social security income. No allowances were given to these individuals. And basically making them work um, in exchange for housing and quote unquote services. But in essence, they were working for free. And Social Security did audit this organization or this turkey farm, and they found nothing wrong. And they weren't out there looking at the actual living conditions. And of course, it took I believe it was an expose piece by a journalist to reveal that, and rightfully so. It created a lot of concerns from the public, but Congress, and that's when they started about thinking about having the PNAs involved, and that's because the PNAs have this wonderful access authority and are really good at coming out into communities and doing these types of abuse neglect investigations. So the reason we have it is because we can do not only the audit, the financial abuse part, but we can also look into, when we do go out there, into the conditions in which beneficiaries are living and if the rep pay is providing housing. And that has also led to a bunch of really troubling referrals back to our investigative unit and back to law enforcement and other folks that can take it on. And so that's a little bit more background about why, how this rep pay world and the abuse and neglect world interplays, and why it's Disability Rights California that is sitting with that responsibility. But with that, I just want to open up some time for any questions that the audience may have, or the panelists may have.
Thank you. Very troubling indeed. So it looks like we do have a couple of questions. Tyler, do you want to facilitate the questions? Would you like me to call them out? How would we like to organize this?
You can. I'm gonna bring Rick if you want. Remember, you guys can always ask questions in the Q&A as well. But Rick, if you want to talk, I'll allow you to talk. You are good to go right now.
Yeah,
Rick,
I'm on my
yeah.
iPhone and I'm blind, and so it's hard for me to use to ask a question in the chat or the Q&A function with my iPhone because I have to type everything in and it's tedious. Besides those with intellectual disability, autism, epilepsy, cerebral palsy, Down syndrome, I was born blind, so that in itself is developmental regardless of intellectual ability, but I lost more sight later on in life. And when I think of, violence, I also think of manhandling someone to get them out of the way or to, so I'm glad I joined this meeting. Are you aware of people that are blind being abused as well as the disabilities above I mentioned? I guess is my only question today. Thank you.
Hi, Rick. Yeah, I'm assuming you're asking me and not other panelists as well. But yes, we do actually have abuse and neglect cases in the abuse and neglect unit, not in the rep pay unit, involving individuals who live with blindness and as well as other disabilities, and many times the conditions are it's kind of tied to the entire experience of an individual being blind, but also having other disability that may exacerbate the conditions and put them in a particular situation where they are housed in a place where they're vulnerable to the types of abuse and neglect that we're looking into. And I should say that because we're a very small team, there's only 6 of us covering the entire state. we often
Actually,
are sitting with a scenario where we get 10 reports in, they're bad, and we can only take 2 or 3 because we have a other cases that are still ongoing, and I think that's probably the part of the job that is most difficult for our staff, is knowing that we don't have the capacity to take on things that we otherwise would look like to look into. And I think in order to maximize our footprint, we do look for cases where we see from just historical data that we keep that there might be a pattern. It might be a case that's part of a picture that's telling us that this is something it's a like a
that's why I kind of, in and with that said, that's why as a person politically involved, sometimes I know I may not be able to get the help I need. Sometimes I take the law into my own hands and deal with that person and give them their own medicine. So given that what you just said, as much as I don't like to take the law into my own hands, sometimes I feel that's the only choice I have, is being like a vigilante and taking the law into my own hands. It dates back to when the state was in a budget crisis and no one was on my side. Everyone was running scared, including myself. Thank you.
Thank you, Rick.
Thank you.
All right. It looks like we have another question too from Grace, and then we'll probably, Teresa, unless you have one, and then we'll move on to the next presenter as well. All right, Grace, you are good to go.
Yes, thank you. You can hear me?
Yes.
Oh, great. Thank you so much. I work at a family resource center. We do have an SSI, a wonderful SSI team here that helps clients and families with their SSI applications. And I have an individual that happens to be my son's roommate. They live in a mentor home, and he was recently awarded back pay of $30,000 from Social Security. And my question for you is, he doesn't have family to help him manage this money. What advice can you give him to make sure that that money that was awarded to him, well, I don't know if it's awarded, but back pay is managed honestly? Because he does have an agency handling that money.
Well, I mean, I guess I want to keep it general because my position is that if an individual does not need a rep E, then they're free to manage that money any way they want, and that comes with the good and the bad of all of us managing money, right? I think I like to think that I save for rainy days and I spend, but I know I don't always, and that is my right, and I think that is how I wouldn't advise him on anything because first of all, I'm not a financial advisor, but I also feel that that is part of the experience of having those funds, and if you don't have a rep A and you're perfectly fine receiving the funds, then he has the right to manage it in the way that he wants. Now, maybe as a family member or a loved one, you can find resources of like maybe there are places where you can get financial advice. Maybe that's a lot of money, and maybe there's some investments or different savings that you can put in. But on this call, I hesitate to give any advice because I don't have that expertise. But I do want to generally say that
Yeah,
I hope he does not get a rep pay, and I hope he
right.
able to continue to self-manage his funds, and I could do a whole nother set of trainings and education on the criteria for when you are selected to be under a rep payship, and while the rules are fairly simple, the execution of those rules are not always that simple.
Right. No,
But
you're correct. It's a lot of money. Want to make sure that, of course, he has financial needs, and that could be it's a blessing, right, for the client. But at the same time, because he is an FH, he is what you call a family home agency, FHA, and but he can ask for a report, right? It's open. It's an audit, right? Is to see where is this money going.
I mean, if it's his money, he should be able to, request an accounting of
Mhm.
what is happening to the money, how it's spent, and that's what we advise. Even being under a representative payship doesn't mean that the money that's coming in is not yours. It is yours by law, and you have um, always have the right to get an accounting of that. The rep pay is just it's merely a fiduciary who holds that money. It's held under your name, and you as a beneficiary, I mean, are clearly identified as the as the owner of those funds and of the account, so to speak. So yeah, I think and since it sounds like this individual is not under a rep payship, I don't see that there should be any hurdles for him to get an accounting.
Great, thank you, appreciate it.
Sure, thank you, Grace.
I just have a quick follow-up. Young, thank you so much for being here. This is so important and I'm just really thankful that you're here. I have a couple questions around, we're doing some work in the supported decision-making space and sort of can you talk to us a little bit about how supported decision-making works in this process?
Oh my God, you just teed up. Thank you for teeing me up. I swear I
This
didn't.
wasn't even planned,
pay
guys.
you.
This wasn't planned, I promise.
Yeah, I know. I did not pay you to show up. But so unfortunately, supported decision making is not even a factor of the rep pay world. And that's so my long-term goal with all of this is making Social Security, and I'm not just talking about the local field offices. I'm talking about the agency, the entire agency that covers the whole country, to make them understand that that is a such a critical tool to prevent some of the things that I've observed, and that it should at the very least always be the starting elements by which a rep pay ensures that they use that money in a way that is the in the interest of the beneficiary. I would love to see supported decision making, and it does not need to be the rep pay that necessarily has that capacity. It could be working with somebody else on coordinating it in order to develop the with the beneficiary that budget plan, that spending plan. And there's another set of eyes on it, including the beneficiary being much more aware and connected to what their money is used for. Because I can't tell you enough how many times I've gone out there and I meet beneficiaries who are absolutely, they know down to the penny what they have, but they're not getting any like supported decision making on 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 accessing resource and using that fund. So it's really frustrating to me to see that there's a low-hanging fruit that the entire system could be built around to safeguard these funds even more. And basically exactly what you just identified, supported decision making is, to me, the end goal. If I had to make a change within SSA and the way that they do they in the way that they look at rep pays and the way that they should change their program, I would want to have supported decision making be a key component. And that is one of the things that I am continually trying to push for. I have my investigators, even though supported decision making is not a term that is necessarily familiar always to Social Security staff, and I've worked with Social Security staff that are incredibly sophisticated in the way they think about disabilities, but many are not. Many are still kind of in the dark about some of these newer ways. Well, they're not new, but different ways of incorporating principles into the way that they look at rep pays. But I've been telling my investigators, so when we submit our auditing report to Social Security for review, and that includes documentation about our engagement with beneficiaries and how they're doing, and how they would like to have their money spent, whenever we can, we actually inject in the term supported decision making in a variety of different ways. so that we hope that, because we submit hundreds and hundreds of reports covering thousands and thousands of beneficiaries, in the hope that when Social Security reviews these, they see these concepts come up time and time again, and it may make them think, wait a minute, why is this PNA, why is Disability Rights California so interested in telling us about supported decision making and how it might benefit the beneficiary? Is there something there? And so we're kind of, in a way, starting already to push for that, kind of in our own little sneaky way, by at least getting them familiar with the vocabulary. And we even sometimes go into describing kind of some of the basic principles of supported decision making in a way that is not like on the nose. But it's one of my, like, it's one of my long-term goals. I hope, it's something that we'll be successful in.
Thank you.
Definitely, thank you. I'm actually gonna move us forward a little bit on the agenda just to give our other panelists the time that we've given them to present their ideas. Young, thank you. I know there's probably a lot of us on this call today or on this webinar that want to connect with you after and explore further education opportunities, partnerships. I hopefully can speak for everybody on the webinar today. We support your long-term goal 100%. The more involvement we can obtain from our residents, from our clients, from our people we love, the people we know, I think the world will be in a much better position to be person-centered and caring the way that we should. Thank you for I see that you put your email in the chat, so that is great. You'll be getting, I'm sure, a lot of activity after today. So I appreciate your time. We look forward to having you back. Hopefully you can stay on and listen to the rest of the panelists as well.
Yeah, I do have to leave in about 5 minutes for another call.
Or another one, a busy
Yeah.
man.
But I appreciate the invitation, and it's been a pleasure, and I love working with Silence Equals Violence. So
Thank you. Maureen, I believe you are next on our agenda. So Maureen from Weave, tell us a little bit about what you do in your presentation today.
Thank you. I have been with Weave for about 3 years, and my role is advocate and specialist for older adults experiencing abuse, as well as persons with disabilities experiencing abuse. I'm not going to spend my time telling you how that program went from this to this in a couple of years. Maybe at another time. I really want to focus on the issues that I've been asked to present, which is about domestic violence and some specific psychological issues and the power and control that is integrated with, as well as older adult abuse and how they are that's similar to domestic violence and how it is different. It's sort of like a Venn diagram. You have the two circles, one's domestic violence, one is older adult abuse, and then they're like this. There are so many things that are common to them, yet there are some very significant differences that I'll talk to in my presentation. I want to let you know that I'm going to do a very brief and overview, but highlighting some of the critical things I don't think most people are aware of about domestic abuse. Do the same for older adult abuse. I know there was some significant, there was some specific requests to talk about some of the psychological elements of abuse. And I will do that, particularly how all abuse is generated from power and control, a desire from power and control, and how that plays out in terms of the intimate partner relationship. And due to the limited time that I have and wanting to be mindful of the time that I have, I will not be talking at length about financial abuse, though our prior presenter kind of talked a lot about what I would say, nor spiritual abuse, nor technological abuse and stalking, which are all part of both sets of abused victims' experience. So briefly, I don't know how many people know that Weave has been around a very long time. I think we were in the 80s, we were the first and only rape crisis center in Sacramento, California. Actually, we were established, I've got my notes here, in 1978. And we were the first domestic violence shelter in Sacramento County in 1986, and the only rape crisis center since 1988. But we do so much more than that. And most people know of us as women escaping a violent environment, but that's not our name anymore. It's when everyone acts, violence ends, because our clients are not simply women, and they're not all escaping a violent environment. We treat sex trafficking, sexual assault, financial abuse, older adults, persons with disabilities, families in crisis. So our clients are far and wide, and we're happy that we have all of them. And our mission now is to promote safe and healthy relationships and support survivors of sexual assault, domestic violence, sex trafficking, and older adult abuse, regardless of gender, age, or any factor that would define someone or would put them in a particular category that we don't here at Weave. So first I'm going to talk about domestic violence, define it a little bit, talk about some statistics, talk about the cycle of abuse, the power and control, the role of power and control, and some of the psychological issues such as gaslighting and isolation, and how that contributes to the demoralization of the victim, the person in the domestic violence relationship, violent relationship, which is one of the factors that prevents them from ever leaving. Because we all hear, well, why didn't she leave? Why didn't he leave? Why didn't they leave? Why are they still there? And there are a lot of reasons why they're still there, and a lot of reasons why it's hard to get out. So I apologize for also going from my notes that are over here and not in front of you, but I will get them all out to you. So all domestic violence, much of older adult abuse, comes from a place of power and control exerted over the victim by the person who needs, for some reason, to control that person and exert power over that person. It can be coercion and threats, verbal and written threats to kill, harm, take away, retaliation, commit suicide if you do this, report to authorities if you do that. So there's lots and lots of coercion. There's intimidation with threatening behavior, threatening remarks, destroying property, taking children away, taking pets away, hurting pets, and perhaps children. There's emotional abuse, which is excessive criticism, humiliation, bullying, name calling, crazy making, and gaslighting. Isolation, where you control how much contact the other person has. You don't want them to have money. You don't let them have a job. You make them have a job, but you find the job, and you're there maybe at the job. Policing any use of their phone, the internet, where they have no freedom, no independence. There's blaming, minimizing, and denial that I didn't do that. What are you thinking? Are you crazy? When did that happen? You must be thinking of something else when the abusive person abused brings something up. And again, that's also a form of gaslighting, which is crazy making, where the person starts to doubt themselves and their sanity. Or they can minimize. I only hit you once. That's never happened before, when it might have. But I didn't hit you in your face. Minimizing a really critical, terrible event. Using others, children, friends, and loved ones, causing guilt about other relationships, using others as messengers, threatening loss of children, friends, and other persons in the abused person's life. But sometimes it's just privilege. That's one of the ways people control. Race, gender, using traditional roles of gender and race to subjugate, to continually keep a person from feeling they have their own privilege. And finally, economic and academic abuse, controlling money, like not giving someone money, stealing their money, preventing them from getting a job or going to school. If they get a job or are enrolled in school, not providing a car, transportation, bus fare. So that's the kind of power and control. And usually it's more than one of these in an domestic abusive situation. It's not just intimidation. It's not just the financial limitation, which is kind of financial abuse, but I didn't really want to separate it out because it occurs within the realm of tactics that a person seeking to abuse someone does use to keep them there, keep them in the relationship, and keep them as an abused person in that relationship. Some statistics: intimate partner or domestic violence affects more than 12 million people every year. 2 in 5 gay men experience domestic violence. 1 in 4 men, straight men, 1 in 3 women, 1 in 3 lesbians, 1 in 2 trans, 1 in 3 teens, and 15.5 million children witness domestic violence every year. 1/4 of emergency room visits are due to domestic violence, and it costs the healthcare system and legal system in the United States about $8.3 million a year. 40% of all abused women are harassed at work by their partners, putting their job at risk. And finally, 3 women and 1 man are murdered every day by their partner. And all of this, again, the focus is on physical, emotional, and to some extent, sexual abuse when sex is used as violence. Some examples of physical abuse that could make any of us feel threatened are throwing things, destroying property, holding someone down, not letting them move, especially if they're much bigger than you and you cannot move. Putting someone in a dangerous situation, like locking them out of their house, locking them in a car, withholding medication and food. We know that happens in all kinds of abusive situations. Imprisoning or blocking, shoving and pushing, grabbing, slapping, shaking, punching, strangling. The incidence of strangulation within sexual assault and domestic abuse is extremely high, and often where there is a pattern of strangulation, there will be death. It will become a homicide. Also, a lot of threatening with weapons, guns, knives, things to keep the person, the victim, afraid and compliant and immobilized. And the emotional abuse is similar: put downs, name calling, manipulation, threatening to hurt you or themselves. I will commit my, suicide if you leave them. Blaming and shaming you, your family, isolating you from everybody, your family, your friends, your children, perhaps, and your other social contacts, perhaps your religious organization, your spiritual path, and your spiritual community. Humiliation, threats, stalking, crazy making, and gaslighting. So gaslighting is subtle and it's very, very powerful. And it's so demoralizing that it is an effective tool at keeping people, particularly women, in their abusive situation. It's a form of psychological abuse where the person, the abuser, causes someone, usually the victim, to question their sanity, their memory, or perceptions of reality. And people experiencing gaslighting may feel confused, anxious and unable to trust themselves. And that results in depression, anxiety, and simply a sense of being traumatized. Some examples of gaslighting behaviors are countering the person's recollection of something and saying, you know, are you sure that happened that way? You must be forgetting things. I don't remember that at all. That's not what happened. You've got the wrong set facts. That didn't happen. Or withholding. I have no idea what you're talking about. I just can't relate to anything that you're saying. I have nothing to say. Or trivializing. You're just too sensitive. It didn't happen that way. No one meant that. I didn't mean that. You are so sensitive. You just can't take a joke. Or denial. That never happened. Or trivializing, like the too sensitive. It was just a small thing. What do you mean? I don't know how you can think that that's such a big deal. And why? Just stop. Stop being such a pain. You're creating the problem. Blaming the victim. I think I'm going to quit my imitations of gaslighting right there. But I practice a little bit of how someone would say it to make you feel like that you are crazy. So that's a pretty pervasive element of psychological abuse, and it does erode one's sense of their sanity, and that erodes their self-esteem and their trust in themselves, which adds to their inability to leave. There's lots of reasons why people don't leave, and I'll get to a list of them. But once your sense of trusting yourself and your self-esteem and your confidence is gone, to climb over the barriers that are necessary to leave that situation where there are often children also involved is very, very difficult. Most domestic violence situations have a cycle of violence where you can start anywhere in this cycle. It's just 3 components. The abuse occurs, whatever that happens to be. It's an explosion, there's abuse, there's a fight, things are thrown. And then there's a honeymoon. There's apologies. There's flowers. I'll never do that again. I love you so much. I'll go to counseling. Yes, you can get a job. And none of those things really happen except that there's no more abuse. And things are quieter. And that may seem like a miracle to some. And then the tension will build. And the person in that relationship, the victim, can sense when the tension is building. The other person's walking style might get heavier, or they might start slamming things. So the tension is building, and the victim starts walking on eggshells because she knows, or he knows, what's coming next. And what's coming next is an explosion and an abusive incident occurs. And that goes on and on and on until there is no honeymoon in there. And it's a lot of abuse and a lot of eggshells and abuse and eggshell walk. And still people are unable to leave. I just want to run through some barriers to leaving and why people stay in abusive relationships. Fear that if they will leave, they will be killed, their children will be killed, or the person will kill themselves. Forgiveness and hope, because this is what they thought they were getting into. Isolation, they don't know about weave. They don't have friends who know about weave. They won't call the police. They know what would trigger more violence. Economic necessity, they don't have a job, they don't have their own money, they haven't been allowed to get a job. They don't have a car, they don't have a license. Just the isolation and the limitations that are put on them. Intimidation and threats by the abuser that they believe because of prior experience. Not wanting to be separated from children. That's a very strong incentive to stay. Threats of losing one's children or losing most of the custody to one's children. lack of resources or information, like WEAVE. Or there are many others, I'm just saying WEAVE. Disability or caregiving needs that they have, that make the victim has, that makes it doubly difficult for them to leave. Their immigration status can be vulnerable, make them vulnerable. Fear and failure and fear of the criminal justice system. Maybe they've had run-ins before and they don't think that the criminal justice system is there to help. And maybe it hasn't helped them before. And so they don't want to go back. Cultural conditioning. I've had women from Southeast Asia. I've had Afghan women. I've had Afghani women. The same thing. I apologize. And in their culture, they can't leave. The cultural values are they can't leave no matter what. The Hmong community does not have a word for rape. It's not recognized in the culture. And if a woman tries to leave after being abused or raped, she is shunned by the entire Hmong community. So some of the cultural barriers are as challenging as any social barriers that others might encounter. Oh, and this lack of, as we've heard others talk about, lack of housing, lack of safe, affordable housing for people who are leaving situations that are challenging, and love. And that's not lost by any reason, but love. That person entered the situation, the relationship, because they loved that person. And maybe with that hopes that that love can conquer what's going on. And when I mentioned the lack of affordable housing, and this goes for older adults too, there is an intersection of abuse and homelessness, and the intersection of domestic violence and homelessness is such that 80% of homeless mothers with children have experienced domestic violence. And 46 of homeless women reported they had stayed in the abusive relationship because there was nowhere to go. And 50% of US cities reported domestic violence as their primary cause of homelessness. And in Sacramento, at the last point in time count in 2019, this is from 195 families were estimated to be unsheltered in that one night. And lots of people who are on this unhoused, and this is domestic violence, older adult abuse, they have prior issues with trauma. And if they find themselves without home, without support, without safety, that trauma is exacerbated and new responses to trauma occur. Quickly, the emotional and physical impact of domestic violence: anxiety, depression, self-blame, difficulty concentrating, fear, social isolation, impacts on employment and education opportunities, financial loss and instability, physical and psychological injury, grief, loss, unhealthy coping mechanisms such as perhaps using substances or other ways of escaping because you can't escape, and at risk of becoming unhoused. And I'll talk about what you can do at the end of all of this. And now I'm transitioning after a breath here to some not uplifting material about older adult abuse. And I'm sorry that I sound like I've had too much coffee, but there's so much information, and I narrowed it down as best as I could. And hopefully you can see where the Venn diagram is and where people are outside of the Venn diagram. So older adult abuse is an intentional act or failure to act that causes actual harm or creates a risk of harm to an older adult. And now that is someone 60 and older. It can include intimate partner sexual assault, domestic violence, psychological and emotional abuse, neglect and isolation, and of course, financial abuse. Financial abuse is the highest the most frequent form of abuse right now among older adults. And everybody who spoke alluded to financial abuse in some way or another. It's the fastest growing due to, yes, AI. They're wonderful and large countries with people that they can coerce to just dial and take. And it's hard to recover the money when it's gone. And with older adults, family members are often the person, the caregiver, the adult child, someone like that who they've entrusted are often the person committing the financial abuse because maybe they've given them their PIN number or the account number or something like that. Trusted caregivers and friends, and of course, scams. And the biggest one that we see among older adults are romance scams. And because many older, very older adults are isolated and they don't have a lot of social contact. So the romance scam or the romance approach that results in a scam fills a void that exists. And even when there's intervention, many go back to the scammer. It's the abuse. The scammer is abusing them and they go back. Okay, am I out of time? Do I have to run quickly?
Yep, I think we are running out of time.
Ah,
But Maureen, no, you're, I could listen to you the rest of the afternoon.
you
because it's your examples, your practicing of gaslighting actually sent chills down my back. So I think it's definitely a topic that I wish we had more time because I want to hear the rest and I want to hear all about the resources. I think that's an important piece to this presentation.
sure.
So if you have that, fantastic. Otherwise, we can follow up with additional questions later. I just want to make sure we've got a little bit of time for our remaining presenters.
Sure. I just want to say this is new, but it is a slide deck that I'm perfecting, and I'll send that to you so it can be sent out and it has both topics and resources.
That's fantastic. Yes, that is great. So group, we will get those slides out to you at the conclusion of this webinar or shortly thereafter. We'll make sure that we've got yours, Maureen, and that Tyler's got a chance to collect everything. If you do have questions for Maureen, please do put them in the Q&A feature at the bottom of your screen. If you hover your mouse at the bottom, that menu comes up and it allows you to ask those questions. We will be sure to get those questions to Maureen and get her answers back to you and the group. And I do apologize for having to stop you short, Maureen, not because we do not appreciate your time, but simply we still have more to go. So with that, I will turn it over to you, Astrid. Welcome.
Thank you so much for having me, and I will condense mine so that we can definitely hand the floor over to Greg. So I am Astrid Zuniga, president of United Domestic Workers, AFSCME Local 3930. For those of you who don't know, we represent about 200,000 home care and child care workers across the state who care for our elderly and disabled population within the state. And I am most importantly a mom of an adult son with autism, intellectual disabilities, and epilepsy, which is part of the reason why I've been part of this group for 6-7 years now. But I was asked to come on today to share a little bit about a film screening I was a part of called Stolen Time, and also a little bit about what UDW has been up to and what are our plans for 2025. I'm going to attempt to share my screen so that actually it's going to not start where I want it to, so that's fine. So can you guys see my screen?
Yeah, we can.
Okay. Sorry about that. My computer's doing its own thing. There we go. So Stolen Time, for folks, I'm not sure if everybody got a chance to see the trailer, but I do have it. It's only about 1 minute and 20 seconds or so. I'll go ahead and play it in a minute. I was approached by the film company and Melissa Miller, who is a protagonist and lawyer out of Canada, who takes on the corporate for-profit nursing facilities where there's been several families who have brought forward claims of abuse and neglect. And as we all know, they tend to be notorious for their lack of transparency and accountability. So it really was very impactful weekend. There was 2 days, a Saturday and a Sunday. And you can see here, we also had Rachel Tate with us from the Ombudsman and Wise and Healthy Aging, who was one of the panelists on Sunday. And we had several home care providers and members of the community who came out and went back and forth with some Q&A, and really it highlighted why it is so important that these types of coalitions that we belong in, we are a part of, like with the Silence Equals Violence coalition partners, where we all can come together to fight for better services, for better housing, for protections and data, and all of these things that we all spend so much time on fighting for our community's most vulnerable. And I will jump ahead to maybe, I guess, see if it plays. No, it's not. Okay, I'm sorry. It's got a mind of its own today. So I'm just gonna stop there. Sorry. It's got a mind of its own today. Because I had a whole other slide here. Sorry, guys. I'm gonna get to it in a minute. No, I'm not. Tyler, do you happen to have the trailer? Because I really wanted everybody to see that.
Let me see.
And I will try to stop sharing if it'll let me. Oh, there it is. Stop share. Okay. Because the trailer is pretty impactful as well. And it just goes to show how much more work there needs to be done with all of our agencies in holding accountability for all of these agencies. Oh, thank you.
She had a stroke, broke a bone in her neck, and she'd been lying in bed for 6 days with nothing but Tylenol.
How hard would you fight to make sure that your loved one is properly cared for?
We want justice! We want justice!
You had a loved one that suffered in long-term care. I kept hearing the same things over and over again. This is not a coincidence. It's something I really want to dig deep and discover.
Systemic failure across all the companies while they bring in record profits.
$1.1 billion in revenue, and they are locking up incontinence pads. It puts all of the blame on the staff when they're a victim as much as the resident.
There is no law to report a medical facility for improper care.
Only one person to look after 40 people. Hurry up!
The residents needed more than what we were able to do.
It's only going to take one smoking gun to blow this open.
Yeah. The damages are very low. Why? Well, old people aren't worth that much. There's this ageist attitude.
There's a complete and utter lack of transparency and accountability.
The cases are unfolding.
They are going to make your life difficult.
I don't even have a sense of how successful I'm going to be.
I will do whatever it takes to change these rules in nursing homes.
My client's relying on me for that last piece of accountability and justice. This is going to be one hell of a fight.
As I said, that is pretty impactful, just the trailer. And they sent that to me and asked me if I would be part of a Q&A panel. While this might have been in Canada, it crosses borders, it crosses countries, that this happens all over the world. And to shed light on it and to have conversations with people and bring awareness was something I was honored to be a part of. And I encourage you all to look into seeing how you can view the whole movie. It's a short film, right? But it was something that I was really proud to be a part of. and glad that we can continue to work within our coalition partnerships and raising awareness around this, and why it falls in line with what we do at UDW, right? We pride ourselves in being a social justice union because it's not always just about our IHSS providers. It's about the things that impact those that they care for, that are often their loved ones. Thank you, Tyler, for throwing that in the chat. And what happens in our communities, right? In our families, at the end of the day, that's what it's about, is protecting and preserving programs and structures and putting safety nets in place that just make their lives better, no matter what their age or ability is. So I was really honored to be a part of that, and happy to be here to just share a minute or two of it about that. Next, I was also asked to share a little bit about what UDW has been up to and what we got planned for 2025. Often Greg will reach out to me, and we will sign on to anything and everything that he has and needs. We are happy to be there to support and jump on board and send in letters. So I'm happy to always be doing that. I think we signed on to a couple of them last year. And for 2025, this year, we spent a lot of time nationally on the Care Can't Wait campaigns and working with Caring Across Generations and other agencies and our counterparts at SEIU to really emphasize the need for the federal government to make investments in the care economy. And whether it's childcare, home care, or home and community-based services, there really needs to continue to be those investments. And I'll have to say, that's why we fought so hard during these elections. In the brief clicking through of the presentation you saw, as I was trying to figure out how to share my screen and get to the video, you might have seen where, people were coming together and were rallying and hitting the streets for all of these things to bring awareness about it. And not gonna lie, I'm gonna say it here, the next 4 years are gonna be pretty scary. And one of our main goals is a federal defend and protect. That's what we're gonna be about, is defending and protecting this program. And IHSS program and all the other programs, our child care providers, all of them. Because if history will replay itself, there will be attacks in the next few years, and we will lose a good 54% of the IHSS funding. And for us, we have to protect that. And that's why I speak to this all the time, because at the end of the day, I'm all about protecting and preserving this program that one day I may need. One of my 11 grandkids might be taking care of me and my son. So, it also impacts our automatic dues deductions, the overtime laws that we just got in 2016 for home care workers, because we really have to continue to make these investments in the workforce so that they can continue to want to be there for our community seniors and those with disabilities. So we plan on partnering with our international AFSCME, doing member education and community education and mobilization, doing coalition work, working with our coalition partners within the disability community. Additionally, we also are looking to support some state cost of living legislation this next year. And our key priority here locally will also be to get to statewide bargaining. Matt Haney introduced AB 1672 in 2023, and we're looking forward to working with him and SEIU to reintroduce it this year. The work group is done. There's some recommendations that are coming forward. So that's kind of it all in a nutshell of what we've been up to, and happy to answer any questions in the Q&A, and then turn the floor back over to you guys and Greg.
You're right, that trailer was pretty powerful. And you're right, nothing has a boundary. Abuse, care issues, barriers to person-centered care, all of that crosses all lines, state, personal, financial, socioeconomic, any of those lines. They are non-existent when we're talking about abuse. Very good. Q&A, drop your questions. We'll be sure to get you some answers. And with that, Greg, I will turn it over to you for about 10 minutes or so, if that's good, to talk about AB 751, AB 449, and anti-disability hate crimes.
Real quick, I'm gonna before we move on to Greg, I'm not sure if she had a question about Astrid, but Garina, I'm gonna allow you to talk if you have a question specifically for Astrid. You are on mute, but you are good to talk.
Is there a question for me?
Potentially. We'll give it another second. Karina, can you hear us?
I can always drop my contact information in the chat and she can reach out to me. By all means, I'll do that right now.
All right. Sorry to interrupt. And Greg, the floor is yours. Thanks, Astrid.
Thank you. I'm Greg DeGier. I'm the civil rights advocate of the ARC and United Cerebral Palsy California Collaboration. And I also sit on the legislative committee of the California Alliance for Retired Americans. I was asked to talk about not just the bills, but other advocacy efforts coming up in the next year, and what members of the Alliance, of the Silent Single Violence Alliance can do. And I'll start with that, since that's what's probably most important. Many of you are on various mailing lists that you get stuff from me. If you're not and you want to be notified of things you can do, write me. It's greg@thearcca.org. Pretty simple. greg@thearcca.org. We're looking at possibly 3 bills this year, and I'll mention who the different we's are in this story. One has to do with, well, all 3 have to do with the criminal justice part of the problem, which is not all of it, but is very important. And they have to do with better enforcement of the existing laws rather than adding new laws, which will also, or reforming laws, which I'll also talk about in a minute. Last year, we passed AB 751 by Assemblywoman Schiavo, which culminated several years of work, but now mandates almost every local law enforcement agency, maybe every local law enforcement agency in the state, to adopt a very strong senior and disability victimization policy, guiding officers. Every call for what we define as senior and disability victimization, which is more than just abuse. It's hate crimes. It's the interference with a mandated reporter in reporting. It's homicide. Any serious crime against a senior or a person with a disability, the law enforcement agencies will now be required to respond to the call. No more, I called them and nothing happened. And there's also a very strong training component to train many officers on dealing much better with people with disabilities, which is, of course, as we know, a problem. And so that is now law. The bill this year, if we can find an author, which may not be easy this year, we, meaning the ARC UCP and CARA, the California Alliance for Retired Americans, will require every agency to have a senior and disability coordinator. So internally, within the agency, there'll be someone who is responsible for doing what the law says they're supposed to be doing. Secondly, there's a couple of potential bills, again, only potential, following up on Assembly Bill 449 by Assemblyman Ting of last year, which needed every law enforcement agency in the state to adopt a hate crimes policy guiding officers, somewhat similar to the senior and disability victimization policies that I just mentioned, and that it involves mandatory reporting, mandatory response, training, so forth. of every law enforcement officer in the state. And these bills will, if we have them, will focus on getting better enforcement of that new law. Things like requiring that whenever a officer has reasonable suspicion that whenever there's a crime and the responding officer has a reasonable suspicion that that it was motivated by bias, which would make it a hate crime, they must take a report and put it into the system, which is the key first step for any hate crimes investigation. And as part of determining whether or not there's crime, they will have to consider the terms from current law, from bills that we passed in the recent past, that go into great detail about what kinds of things to look for as anti-disability hate crimes. Things like contempt, so forth, that every officer should know. The other part of that bill, again, if we have a bill, is to require that, current law, the bill that we passed last year, says that every law enforcement agency must submit their hate crimes policies to the Department of Justice for compliance checking, to make sure that they have everything in the policy, the guiding officers, that they're required to have. And if they don't, DOJ will instruct them to fix it. The current law says that the DOJ in their annual report to the legislature shall list all of the agencies that have complied. We want them to also list agencies that have not complied, to create some social pressure on them. This is an accountability procedure. There's one other bill, and I should mention that first one, the Senior Disability Victimization Bill, that's sponsored by the ARC and UCP and CARA, the California Alliance for Retired Americans. The one I just mentioned is sponsored by 8 different civil rights groups led by the ARC and UCP. The next one, which is a possibility, is sponsored by the Hindu American Foundation and the Asian Law Alliance to recognize that discriminatory selection of victims may be an indicator of a hate crime. If there are, the most glaring example is the Harvey Weinstein. If Harvey Weinstein committed multiple sexual assaults of women, there were many men available to be assaulted. He did not do so. He exclusively assaulted women. That's discriminatory selection. That in that case, police should look for evidence of a hate crime. That mere discriminatory selection doesn't prove a hate crime, but it should send them to look for it, and they'll never find it if they don't look. Next steps are all of those have to do with enforcement of current law. We're looking at the much broader picture of not what the law is, but what the law should be, criminal and civil. And in 2019, when the administration was beginning to develop the Master Plan on Aging, 21 organizations submitted a letter asking for 18 elements of a senior and disability victimization policy component of the hate crime of the Master Plan on Aging. The administration did not do that. What they did do, I won't characterize why I think they did it, but what they did do is simply refer it all to the Coordinating Council, which we heard from. Coordinating Council has done some great work. We heard about that, but they have not taken it up as a comprehensive, not taken up our proposals as a comprehensive plan, which actually you can't blame them for. They're not structured in a way to do that, to develop a comprehensive plan with all of the provisions that we suggest. So we are looking at some other agency, and it's been suggested that the Little Hoover Commission is a state agency that is established to do exactly this kind of thing. Take a serious look at a problem in depth, listen to the public, and propose a multi-part, if necessary, solution. So we are talking about finding a way to convince the Little Hoover Commission to undertake that study, and it would be they would take into account the 21 points that the groups raised in 2019. The California Elder Justice Coalition blueprint of their most recent version is last year, which has some parts have found their way into action. The comments that the public made at a disability forum that we were able to convince the new Commission on the State of Hate to hold back in October. It was quite enlightening to the commission, which has no members in the disability community who are members of the commission because the powers that be did not appoint any. But they listened, and we were suggesting that the public comments from that forum and another one that we're asking the commission to also hold, the Commission on the State of Hate to hold, all those go into the commission on the Little Hoover Commission report on coming up with a comprehensive plan. Lastly, no, I don't have time, is the we're trying to get the Department of Justice to require that all law enforcement agencies, how can I simplify this? All law enforcement agencies, under current law, all enforcement agencies must use the new California, what's it called? It's called CYBER, the California Incident-Based Reporting System, to start replacing paper reports. And it has to include the content specified by the Department of Justice. The Department of Justice has specified some hate crime reporting content, but not enough in that. We want them to include all of the items from the supplemental hate crimes report that we included in the hate crimes bill that passed last year, so they can get rid of the paper report and make it a real-time report in electronically to DOJ. Was I within 10 minutes? Let me just say again, we're available to consider supporting initiatives that any other group raises, and we ask that any groups or individuals who are interested in supporting any of these initiatives, please write me, Greg at the ARCCA, THEARCCA.org. I'll put you on the list.
Thank you, Greg. Tyler did drop your address into the chat for everyone. So if you folks did not get to write it down while he was speaking, then you can claim it from there. Thank you very much. I really appreciate hearing about all of your efforts as well. Keep up the fight. I know we don't always make progress every year, but I feel like the more we keep talking about these things will happen. Let's keep everything in the forefront and under the limelight. That is also part of our responsibility. Any questions for Greg? Go ahead and drop them in that Q&A feature, and we'll be sure to get them to him and responses back out to everyone. With that, we are in the final 3 to 4 minutes of this conference, the Silence Equals Violence conference. I want to thank you for being here today, and also let you know that by registering for today's meeting, it did allow us to collect some of your contact information. So at the very least, you'll not only receive the materials from today's conference, but you'll also receive an invitation to the next Silence Equals Violence meeting on February 20th from 1 to 3. We look forward to having you there. Let's see. Were there any other questions, Tyler, that I'm missing before we close out?
Not that I know of, but if you guys have any, most of the presenters' emails are in the chat. So if you guys have any specific questions, Maureen, Greg, anyone else who presented as well as us, feel free to write them in the chat, and then we will send this recording out as well after.
Well, with that, I hope you enjoyed today's agenda. I hope you learned something. I hope it re-motivated us to hit this new year with, running and continue our efforts in solving some of these huge crossing boundary issues. So thank you very much for being here. We look forward to seeing you again in February. keep communications coming and going. Until then, happy holidays, everyone. Take care of yourselves.